Hello team, we continue with our training and coaching cycle. We have seen the video of the client's discovery. We have also seen the video of credibility. We have seen the video of money and also the video of Funeral Consumer Guardians Asylum. Now, once we have presented the product, we are going to ask our client if they have any doubts or questions for me. And usually the question that the client asks us is, how much does that cost for me? In order to provide an estimate to the client, we need to know what the client's health is like. Let's all remember that our application is only a sheet. What do the questions contain? The first question refers to tobacco or cigarettes. Then we have the two questions of uninsurability. The first refers to the applicant having tested positive for HIV or a doctor having diagnosed them with AIDS or a life expectancy of 12 months or less. And the applicant is currently confined to bed, hospitalized, or in a palliative care center. If the client answers yes to these two questions, unfortunately, we cannot help them. It is extremely unfortunate. Following that, the inquiries regarding significant illnesses are asked. Let's remember that depending on the health of our client, we will be able to qualify them for one plan or another. Our product joins the bands, but it is divided into 4 plans. The final expense plan, the 20-year payable plan, the modified 2-year plan, and the modified 3-year plan. So everything will depend on the health questions, on the response that our client gives us. So, in these significant illnesses, it states like this. If the answer is affirmative to any of these questions, your death benefit will be adjusted. So, in the last 2 years, Mr. Client, the applicant has been diagnosed or received treatment from a doctor or has taken medication for any of the following diseases. First, have you had any heart disease like heart attacks, heart surgery, or cognitive heart failure in the last 2 years? Please answer with yes or no. Disease of the circulatory system, including stroke, aneurysm, or you have been recommended to have surgery to improve circulation. Yes or no? What is going to happen regarding this question 2? Suddenly our client had an event more than 2 years ago, for example a stroke, but his doctor, to protect him, prescribed a medication to help thin his blood, to liquefy his blood. Even though that medical event has been more than 2 years ago, if today our client is taking a medication for that, the answer will be that he will qualify for a modified plan. Then question 3, cancer apart from basal cell skin cancer, yes or no? In this question 3, we also have, so to speak, a thread, because suddenly our client went through a cancer process more than 2 years ago. However, if our client is currently taking the medication to prevent a relapse, which is a medication that oncologists typically prescribe for a duration of 5 years in order to safeguard the client. If the client is in that process, in that 5-year period, then he will also qualify for a modified plan. If he's past 5 years, if he's no longer on pills, then he'll qualify for a plan with immediate coverage for natural Western death, meaning we'll qualify him for final expense or ideal pay. Question 4. Lung disease other than asthma, including chronic obstructive pulmonary disease or COPD, for their livers in English, or emphysema, yes or no? Do you have liver or kidney disease, or have you had an organ transplant? What is the significance of question number 5 for our team? Many transplanted people, or transplanted patients, in other words, no matter how long it has been, right? In general, those patients typically continue taking a medication in order for the transplanted organ to function properly, okay? So suddenly the transplant was over 2 years ago, but if he is currently taking medication for his organ to function properly, that client will be on a modified plan, okay? Then question 6, Alzheimer's disease, dementia, organic brain syndrome, or ALS, is that correct, right? In parentheses, Lou Gehrig's disease, known as ALS for its acronym in English, alcohol or substance abuse. In this question 7 about alcohol or drug abuse, it refers to the diagnosis of alcohol or drug abuse, that the patient is diagnosed with it, that the patient is even taking medication to prevent that addiction. It does not refer to that gentleman who suddenly on Sunday, to make his barbecue, drinks a beer, or that lady who, to cook on the weekend, drinks some wines. It does not refer to that. It refers to the abuse of alcohol or drugs, or even the doctor when he is medicated. Question 8. Complications of diabetes, including amputation, diabetic coma, blindness, or kidney disorder. Not to the controlled diabetic patient. No, not that one. Not the patient who is fine, who is controlled with metformin, who is controlled with insulin, whose blood sugar levels are fine. No. It refers to the patient who, unfortunately, due to sugar, has already had to undergo some form of mutation in a finger, in a foot, right? Or he already has a renal commitment and that patient has to do the analysis. Or that patient who is already blind due to diabetes, okay? So there, if this complication arises, the answer is going to be yes. And then question 9. The applicant has been given or recommended a diagnostic test related to the previous questions, except for the one related to the human immunodeficiency virus, in parentheses, AIDS virus, for which they have not yet received the results. What happens if the client answers yes to any of these questions? The client is going to rate a modified plan. If he has all the answers in the negative, then there we will decide the plan. It is the age of the client. Although it is true in our red book, when we read about the types of plans on page 2, the final expense plan refers to the fact that we can provide coverage to all individuals from 0 years old, that is 30 days old, up to 85 years old. In general, we will qualify for this plan all individuals who have answered in the negative to the health questions and who are above the age of 66 years old. The person will have immediate coverage for natural death, accidental death, and will pay for the plan throughout their entire life, regardless of how many years they live. Now, let's assume that this client we are currently talking to has provided negative responses to all health-related questions, but is between 30 days old and 65 years old in terms of age. We will be able to rate this client a 20-year payable plan. There is something very important regarding this 20-year payment plan. The REU also tells us that we can qualify all individuals from 30 days old to 80 years old. At this particular moment, what is going to happen? What is the rationale behind suggesting to put it up to 65 years of age in this plan? Because this client has the potential to make payments for their plan. For instance, an individual who is 50 years old, correct? It has a fairly long life expectancy, right? It is regrettable to put that client on a final expense plan that they will have to pay for their entire life, 80, 85, 88 years. If I qualify the client for a 20-year payable plan, this person, when they reach 70, after 20 years from 50 to 70, doesn't have to pay anything else. 70 years old, from 50 to 70, 20 years passed, this person no longer has to pay anything. And all the other years that this client lives, will he have his insurance in force, correct? He is not paying anything, and when he dies, Lincoln will have to pay his beneficiary, okay? So that's the reason why we can still qualify a plan of any age in final expense or payable over 20 years. But if a person under 65 really has more opportunity to live 20 years, right? And all of the additional years that she lives because she already has her coverage, her plan paid for, okay? That truly is up to us as agents, but yes, it is genuinely an interesting criterion to carry out the task in this particular manner, okay? You know what I mean? I repeat, this person, this young person of 65 years or less, has the opportunity to live 20 years, pay their plan, and then the remaining years they live, they don't pay anything. What will happen? Whether it's with the client I'm qualifying final expense or with the client I'm qualifying payable for 20 years, when they pass away, Lincoln will pay. Whether you pass away in months or pass away in a few years, the company will provide payment. However, the duration for which this client intends to make the payment to Lincoln is of significance. Occasionally, I converse with colleagues who primarily work in the English-speaking market. And many times they tell me, Alejandra, in the English market, people really don't know a 20-year payment plan. In their minds, they comprehend that they must pay for the plan for their entire life. That is acceptable, isn't it? But I repeat, work team, it depends on the age of the client. How long is good for that client to pay the plan if it is for a lifetime? Considering that they are a young person of 50, 52, 55, 60 years old or for 20 years, that they will most likely live and they will already have a point of finishing paying their plan and then they will still be covered for the rest of their life. The plan has been modified for a 3-year period. In this plan, we will qualify all individuals who have responded positively to at least one of the health-related questions. That individual will be on a modified 3-year plan. We have the ability to see the individuals who are going to qualify for this plan on page number 10 of the document. If 6, okay, they are all the people, it says here, from 0 years old to 49 years old. If you answer affirmatively to one of the health questions, you will be eligible for a plan with a waiting period of 3 years. This person will have immediate coverage for accidental death, and for natural death there is a waiting period of 3 years. What is the outcome if this client we are assessing there passes away as a result of natural causes during the first year? Well, Lincoln will return to the beneficiary all the premiums paid plus 10%. What happens if this person dies in year 2? Lincoln will pay the beneficiary all the premiums paid plus 20%. And what if the person dies in year 3? Lincoln will refund all premiums paid plus 30% to the beneficiary, always with the support service to the family through Funeral Consumer Garden Society, which is crucial. After 3 wires in 1 day, this client has both coverages. The accidental coverage is activated from day 1 along with the natural coverage, right? That is significant. Now, what occurs if this client who indicated affirmation to one of the health inquiries is in the age range of 50 to 85 years old? Then he will have instantaneous coverage for accidental death, and for natural death, he has a period of waiting of 2 years. If this person passes away in year 1, Lincoln will refund all the premiums paid plus an additional 10% as a reimbursement. If I pass away in year 2, then Lincoln will refund to the beneficiary all the premiums paid plus an additional 20% with the family support service. And after 2 years and 1 day, this client already has both coverages. The Western coverage, which they've had since day 1, and coverage for natural death. So those are the 4 plans. And that is the criteria that I must handle as an agent to know in which of the plans I am going to qualify my client. That is important because each of the plans has a different rate value, and depending on that, I will calculate the premium amount and I will be able to provide the estimates to my client. Well, I hope this is advantageous and valuable for the qualification work and to commence wrapping up our client. Thank you.